Today we have Dr. Marcus. What are the common factors that you think that largely impact corporate leaders and many everyday individual performance the most?
I think the real magic is what happens in here, not the brain, but the mind. I had a very close friend, someone who I've been working or supporting with for many years, and 2 weekends ago, he just swam the English Channel.
Did you always know that you would be working at the cutting edge of human performance, or it just happened like...
I'm a biology geek. I've always taken great interest in just exploring the body and brain and the limits of it, how far we can push it.
Obviously, you just spoke about you are an explorer and you are an entrepreneur. Which of these roles have actually surprised you the most?
Probably none of them. Probably parenting and becoming a father has been the role that I've gotten the most joy out of, for sure.
So if your friends had to describe what you do in one sentence, what hilariously wrong guesses do you think they would make about you?
I don't think my mom still knows what I do, honestly.
Wow.
When I started the clinical practice 6-7 years ago and sort of went into this conversation around longevity, now I think we take it for granted, Gaurav, that, we're seeing that word everywhere. When I started, people couldn't even pronounce the word. They would call it longevity and other sort of variations of that. I think there's been a massive shift towards the 4Ps, which is proactive, preventative, personalized, and participatory role towards their day-to-day health.
How do you define longevity?
There's, of course, the Elon Musk approach, which is around consciousness and sort of downloading human consciousness, but that's sort of beyond the physical frame. My view is very much on the health span component, which is how do we live healthier for longer? How do we ensure that chronic disease occurs later in life? Normalization of health back to where it should be, which has now been depreciated because of the convenience cultures that we were just describing and the explosion of non-communicable lifestyle-related diseases day to day.
Hello, everyone. Welcome to the second season of Health Forward. As we have always spoken with one of the key distinguished people in each one of our sessions earlier, today we have Dr. Marcus, who is not just a healthcare focused individual or a professional, but I think he's brought a lot of insights, and his experience and his work has brought a lot to the country. So today we are going to talk to him on his achievements, what he's been doing, and what are his thoughts on some of the issues or areas that we would like to look at and discuss here. So thank you, Dr. Marcus, for your time. Thank you for connecting. And I'm really very happy to connect with you. As I said that, we did connect, we did work briefly earlier. So welcome to this and look forward to talking to you for the next few minutes to understand from you many things. So if you would like to give an opening comment, and then probably I have a few questions that I would like to start with.
Look, it's lovely to be back with you, Gaurav. I was just remembering, I'm now 2 kids later. You've got a lot more facial hair. I've got less hair on my head. This was well over 10 years ago since we last worked together. So thanks for the opportunity, and I hope we can provide some wisdom to the audience.
Thank you so much for that. So let's start with the first question without wasting more time. Few of the general questions to start with, just to understand a little bit more about you. As I said earlier, you have been doing a lot on the side of human performance. Did you always know that you would be working at the cutting edge of human performance, or it just happened like unexpectedly for you?
So, look, I'm a biology geek. I've always taken great interest in just exploring the body and brain and the limits of it, how far we can push it. The early part of my career was spent in the military services, where I did my first degree, which is in human physiology. And through the field work that I was opened to do, Mount Everest, the Arctic Circle, I worked at Kennedy Space Center on the human spaceflight program. So I've always had that passion for understanding the limits of our performance and capabilities, what happens to the human biology when you push it to the human edge, and how we can learn from it and apply it to our day-to-day lives. And now, many, many years later, I'm able to sort of connect the dots and keep myself busy.
No, I think this is really very interesting. And to be frank, I didn't know much about this piece. And I'm sure we are going to figure out some of these points or some of these topics that you just spoke about, but definitely seems to be interesting and not something usual which people do. So, you are a doctor, you have been and you continue to be a consultant. Obviously, you just spoke about you are an explorer and you are an entrepreneur. Which of these roles have actually surprised you the most?
Probably none of them. Probably parenting and becoming a father has been the role that I've gotten the most joy out of, for sure. I think, like everyone watching, perhaps if they have children, they'll also comment how it really creates a sense of purpose and priority in life. And I've sort of helped channelize that efforts towards not only the way I live my life, but then how I want to bring myself and help others do so. I think too many people today live in a convenience culture where we are subjected to an environment which is not set up for our success in the long run. Biologically, we've evolved to confront stress, good stress, periodically, and that allows the body to learn, adapt, and thrive through that process. Unfortunately, we've sort of been designing and building an ecosystem around us, which is slowly trying to remove so many aspects of what we call hormetic stress, or those environmental good stressors in our life, whether it be temperature, whether it be calorie restriction, all of these things. And because of that, we're now habituating bodies which are increasingly frail, which have chronic disease occurring at an earlier and earlier stage, where the body and brain is not being able to fulfill its expansive capabilities, right? So this is sort of how I've sort of used that energy of parenting to make changes in my life so that I can ensure that I continue with the energy, the vitality, the passion, the ambition, the joy that I want to keep doing for many, many years to come, and helping other people do the same thing for themselves as well.
Yeah, I mean, when you're talking about it, I can connect to some of the things that you just said, but I just love that term of convenience culture that you spoke about. And I think that's actually what's happening in today's world with all of us. Uh, Moving on to, everybody has the side that people know and people look at, while there is something which is not looked at, or which is kind of hidden or misunderstood. So if your friends had to describe what you do in one sentence, what hilariously wrong guesses do you think they would make about you?
I don't think my mom still knows what I do, honestly.
Wow. Okay.
So when I started the clinical practice 6, 7 years ago and sort of went into this conversation around longevity, now I think we take it for granted, Gaurav, that, we're seeing that word everywhere, from the front page of the Economist magazine to most conferences today, whether it be tech conferences or FMCG conferences. Health, wellness, longevity, these have become sort of new
Yeah.
buzzwords. But when I started, people couldn't even pronounce the word. They would call it longevity and other sort of variations of that. I'm happy now that people are becoming more aware, that they're bringing it back into day to day. I think there's been a massive shift towards preventative care, personalized medicine. The younger generation today taking a much more proactive approach towards their health, so that we're seeing cigarette smoking coming down, alcohol consumption coming down, sport activity changing. So I think the world has changed on the back of the pandemic through the dissemination of content, some of it bad, some of it good, through social media, and the integration and the commoditization of wearable technology, just creating more data for everyone. I think these sort of forces have started to come together that allow people to take what I say the 4 Ps, which is proactive, preventative, personalized, and participatory role towards their day to day health.
Great. Longevity. I hope I pronounced it perfectly as you thought. Is definitely a buzzword these days. But how do you define it beyond just like living longer? I mean, I think you did talk about some of the things in the previous comment of yours, but if you could talk a little bit more about it.
So yeah, my lens of longevity is actually not lifespan. There are different ways you can define this word. A lot of the Silicon Valley tech bros, the Brian Johnsons, which a lot of people would have heard of, the Peter Diamandis, Tony Robbins, Ray
Yes.
Kurzweil. These are all individuals who are looking at extending lifespan, the number of years we can physically live. There's, of course, the Elon Musk approach, which is around consciousness and sort of downloading human consciousness, but that's sort of beyond the physical frame. My view is very much on the health span component, which is how do we live healthier for longer? How do we ensure that chronic disease occurs later in life? How do we keep ourselves in an optimal state for as long as possible? As a side effect of that, we may potentially enjoy a longer lifespan. But the first component, it's almost a normalization of health back to where it should be, which has now been depreciated because of the convenience cultures that we were just describing and the explosion of non-communicable lifestyle related diseases day to day.
I think that perfectly explains and sums up everything that probably you were talking about. And I think obviously the audience, but I'm sure that all of them have got will have a lot of takeaways by the time we end this, because a lot of this just seems to be a novel concept or something new or something that people generally they talk about it, but as you rightly said, not in the right sense or not exactly what it means. So here, if we take it forward, what role do you think this a data personalized health tracking, which we track these days through multiple gadgets, how does this play in unlocking peak human performance?
I'm a big fan of data because I've always sort of propagated this idea, which we learned in med school, which is I can't treat what I can't measure. I like to look at the objectivity of data. Of course, the subjective story, the human experience is critical. As a doctor, you want to take the clinical history to know the individual comprehensively and holistically. And then the data can act as a great layer to either reinforce the efficacy of what's being done or to change course, change direction. A lot of people today, let's give the example of Instagram. Everyone on Instagram will be subjected to magnesium to be taken at night to help them sleep better.
Yeah.
And it's true, magnesium is a wonderful micronutrient and it has various effects on the body, many of which involve recovery. But magnesium is not effective in everyone. So the simple device that one can use maybe to track sleep, either a ring or a band or any of these devices, a person can wear that device, consume the magnesium, and see whether the magnesium is actually leading to an
Wow.
elongation in TST, total sleep duration, or REM sleep, or deep sleep, the various phases of
Right.
that. Because if it's not, and I actually had a case this morning where I was seeing a father and a son, and they both had different effects around the utilization of magnesium. One, it was effective, the other, it was not. So if it's not effective, then we can try another substance, another micronutrient, another version of a lifestyle modification. But if you didn't have the data to close the loop, then it'll be very ineffective to know the direction that you should be nudging a person towards. So I think we're all a universe of n equals 1, and we can use data to our advantage, either to educate and raise awareness, or to use the information to reinforce or drive a new shift and change in our clinical protocols.
Yeah, I think in times of when we are living in times of like social media and just kind of swiping reels and listening to so much sometimes contradicting statements or contradicting stuff, I think sessions like this with experts like you really make so much of sense, because because this is the reality, this is what is the truth. So thank you so much for sharing that. While we were like kind of looking at your work and seeing what you have been doing, we also came to know that you have worked with very elite athletes, You have worked with corporate leaders and many everyday individuals and other people. So what are the common factors that you think that largely impact their performance the most?
I think the real magic is what happens in here, not the brain, but the mind. I had a very close friend, someone who I've been working or supporting with for many years. And 2 weekends ago, he just swam the English Channel from England
Okay.
to France. He was the 40th Indian to do so. It took him, 20 plus hours or something like this. And as I was listening to his story, I couldn't help just be inspired and sit in awe about the way he described the power that his mind was able to have over the body. And I see this day in and day out with ultra marathon runners, with IPL cricketers, with Olympians, Paralympians, with corporate leaders, everyone who I have the the joy of working with. I see how they obviously optimize the body, but their ability to bring the brain and the mind into a flow state to maximize the benefit of good stress in their life, the discipline of making the changes and sticking with the changes and the process, and they reap the rewards because of that. So I'm always a fan of that, so much so that when I wrote my first book, which was called At the Human Edge, the very, very last chapter I dedicated to mind over matter, because irrespective of all the physical disciplines that I went through and I did research around, I found that, the real magic happens when we use the power of the mind.
Yeah, definitely something which a lot of people can't relate to, or they can't follow. But I guess what you said is magic is in the mind or in your brain, that kind of drives you to achieve what you really want to achieve. Now here we are talking about somewhere about longevity science that you spoke about, and then there is something called as lifestyle medicine. How do you think these two can kind of work in the mainstream healthcare? Because
Yeah.
healthcare is kind of about preventing diseases, it's about curing diseases, and then you have lifestyle medicine, and then you have longevity science. So how do you think these can work together rather and not kind of compete with each other?
A great question. And I think it's therefore important that we go back to the definitions. True longevity medicine that comes out of the field of longevity science is really looking at the lifespan change. So, what is the process of aging? Aging is a process. There is a definition around that. There used to be 12 hallmarks of aging. There are now some 16, 17 every few years. The scientist keeps adding to that. And as scientific principles get understood and those metabolic pathways or those cellular pathways are understood, and novel therapies or interventions can be developed to actually elongate, reverse, and change those, that is longevity or rejuvenation, longevity medicine, right? And the science of that, whilst it's been happening for 30, 40, 50 years plus, the reality is that the needle of human lifespan has actually changed very little. Global lifespan has improved.
Yeah.
McKinsey did a big study a few years ago showing a 19-year addition to the average life expectancy
Wow.
around the world, primarily because of elevation of people out of poverty in China, India, and sub-Saharan Africa, the consumption and dissemination of genetic medicines for non-communicable diseases, and then better surgical and hygienic practices.
Right.
But there has been an extension of human life expectancy, but the lifespan of the human, the maximum lifespan, has not changed very much at all. We're still at that 121, 122 number. And if the longevity science is truly going to show a dividend, it'll have to extend that. People talk about 140, 150, 200, but we're, I think, a long way away from that, from actually doing that. So the lifestyle medicine practices or functional medicine or integrative health, these are all different flavors of the same thing. Those are all focused on health span. How do you use lifestyle in a preventative, proactive, participatory, and personalized way, Medicine 3.0, to improve healthcare outcomes and
Right.
enhance healthiness so that we stay healthier for longer. That's the second approach, which I think on a population basis is actually a much more powerful change that we need to see in the world.
Great. I mean, I think that was very beautifully put, while you compared all the different terminologies and you also brought them together. So thank you for that. If you need to identify or you are asked to identify one breakthrough in human performance science that you think you are most excited about right now, so what would that be?
Wow. I would probably get most excited about the new small molecules which are being prescribed or used to help improve the longevity piece. Some of our audience may have read about or heard about molecules like rapamycin. That's probably the leading candidate when it comes to extending lifespan in
Okay.
all types of animal, mouse, worm, yeast models. The first in human studies are just about to happen. There are other candidates which we've been looking at. When I say we, I mean the scientific community has been looking at for the last 10 years or so. Metformin, which is a drug used in anti-diabetic medication, can
Yes.
potentially have effects. The GLP-1 agonists, of course, people have heard the brand names, Monjaro and Ozempic. The GLP-1 agonists, the semaglutides, etc., they potentially may have a role to play in improving lifespan. And like that, there are two or three other molecules which are out there, right? So I think this is a very interesting space where there is off-label utilization of drugs or molecules that we have in existence today, which may, through a variety of different cellular mechanisms, help enhance lifespan. On the health span side, I think, especially for the audience in India, which is probably watching, hormones or hormone replacement therapy, particularly for women as they get perimenopausal to menopause to postmenopause, can have a massive benefit in alleviating symptoms and suffering. But most importantly, to help prevent women from advancing decline in sarcopenia, which is muscle loss, osteopenia, which is bone loss, and cardiovascular conditions as well. So hormone replacement therapy in women and men, testosterone utilization can help manage health span. There's a lot more efforts going into the world of stem cell therapy, which is not just intra-articular into the joint, but intravenous into the whole body to potentially enhance rejuvenation, immune functionality, repair, etc. So I think there's some really interesting stuff which is happening. Of course, clinical research, clinical rigor, and caution is required. But potentially, if we have this conversation again in 3 years, a lot of those might become mainstream and potentially offered in hospitals and rejuvenation clinics, and people will have more access to them.
Yeah, I think, and for a lot of us, while we hear about these medications, some of these which are in the news, the effects, and we see people taking it and their larger impact. But I think largely for people like us as audience, I would say the breakthrough is that there is a terminology like longevity medicine. There are experts like you who are imagining, who are talking, and who are doing a lot of work, and who are studying it and researching it, and making it possible. So thank you for that. I think that was really a very interesting insight on what's happening today. So that was really very helpful.
Great.
If you had to kind of design the perfect longevity routine for an average person, what would be your top three non-negotiables, or what's your secret rather?
My secret, which I share openly, is actually a simple framework of 5 things. Number one is sleep. We all need to be sleeping more and sleeping deeper and sleeping better. Various ways of doing that, but I'll just stick to the framework. So, number one is sleep. Number two is move. We all need to be moving every single day. I'm not talking about exercise, I'm talking about movement. You can choose your form of movement. It could be dance, it could be household chores, it could be pickle, it could be running, swimming, cycling, it could be a sport. But everyone should be moving every single day. Number three is fuel. Again, not diet. Don't be constrained by things I shouldn't be eating. Instead, develop a sense of joy in things you should be eating. Real food, not processed, not out of a packet, but wholesome macronutrients which give you the protein, the fat, and the carbohydrate and fiber that your body and your gut requires. So that's the third thing, fuel. The fourth is breathe. We are living in an increasingly stressful world. The environment is becoming stressful because of toxins, air, water, noise. The food is becoming stressful because of antibiotics and chemicals. The water is becoming stressful because of microplastics and pollutants. And our work is becoming stressful. There's so many stressors that we need to be breathing more, breathing slowly, breathing calmly, breathing deeply, and mitigating stress. And the last of my framework is connect. Connect with people, connect with nature, connect with yourself. Because if that connection doesn't exist, then frankly, what's the point of doing all of these things that we're trying to live longer for?
Very, very interesting. And I think my score would be something 3 out of 5. Probably not at the level that you are talking about, but at least a larger level thing. But
Good.
yes, definitely, I think each one of us have a lot to do and lot to push, our limits individually. And I think this was a great mantra for everybody who's listening to this and, who would listen to this at some point of time. My last question to you, looking ahead, what's your big vision for the future of human optimization globally?
I think I'll go back to the point that we probably began, which is we've all become too comfortable being comfortable. And I hope that we can each build into our lives micro moments of good stress, which will help us unlock great levels of power and capabilities. It could be the simple act of taking a cold shower in the morning. That's a micro moment of good stress. It could be the act of eating dinner earlier or restricting your calories. That's a micro moment of good stress, right? It might be trying a new hobby or a new task for yourself. That's a micro moment of good stress. The body learns when it is stretched, and that allows it to become a ever expansive version of itself. So that would be my message to everyone, which is just become more comfortable being uncomfortable once again.
I think that was amazing, and that was just very beautifully put forward for everybody who's listening to this. Uh, Thank you so much, Dr. Marcus, for your time. I think a lot of us who did not know much about this space, I think at least they have a broader idea and understanding of what it means. And definitely, your 5 mantras are the way forward, and which I think whoever listens to this should kind of definitely follow this to make sure that we do live a healthy, not a long, maybe a long, but then more of a healthy and a more comfortable lifespan. So really appreciate your time. Thank you so much, and we look forward to meeting you soon again. Thank you.
Thank you. Bye, everyone. Bye-bye.